Hello, viewers. My name is Barnabas, and I'm a registered nurse. I have practiced in the area of Boston for the last 18 years. What a great honor and a privilege to be talking to fellow countrymen of Uganda, fellow countrywomen of Uganda, especially viewers of UCTV. It's also our pride. Thank you, the team of UCTV, for allowing me to share a little bit that I have as of my background experience, where I live in Boston and what I do. So like I said, I'm a registered nurse. I have been in practice for the last 18 years. I went to Boston kuba ekyeyo, embeera bwe zigaana zikyuka, you find yourself in a fix, and when an opportunity lands in your hand, you say, yeah, let me be part of those people who are seeking greener pastures. Embeera z'ebweru si mbeera nti the way most people think about it. It's tough life, and we live it with a lot of challenges. For myself, I started to work with the elderly. That was the opportunity that was available to help old people live comfortably in their homes. And that's where really the other opportunity came from. I was helped by one of the people I took care of to go to school, and I took it on myself. I went to college and graduated with a degree in nursing. I have been working as a professional in the United States for, I said, 18 years. I have worked on acute care units, hospitals, worked on rehabilitation centers. I have worked in nursing homes. I have also worked in home care settings, and not until when I experienced several people dying, and there's also a specialty of hospice care, then I found my heart more inclined to hospice, and so I do take care of the dying. I'm here, you see in the background, Vantage Care Limited Uganda. That's a home care company. It's a program that has been brought to Uganda. I'm very proud to tell you that my wife in the United States runs a home care business. And because the United States has serious regulations and policies, to run a business in the United States is a very serious component of service. I decided to bring Vantage Care to Uganda because I experienced a situation with my mother. My mother is 81 years old. 3 years ago, my mother was going to the hospital every 3 months. Why? Because she's aged. My mother has diabetes, my mother has hypertension, cardiac disease. My mother yerabira because of old age. My mother is incontinent because her muscles are weak. My mother doesn't know why she's taking medications. So she would forget to take her medications. She wouldn't know how to take her blood sugar levels with a finger prick. Her hygiene was poor. And so she was very much prone to getting sick every now and then because of poor management of chronic diseases that she has. What happened 3 years ago is that she was admitted to the hospital, Nyachiwale Hospital, unconscious. We didn't think she was going to make it. So when she recovered, that's when siblings decided that mother might need better care than what she's getting. So by finding someone locally and instructing them how to manage my mother's diabetes, checking her blood sugar levels every morning, making sure she takes her medications, making sure that her bed is well laid, making sure that when there's any change in condition, she's confused. Maybe that's an infection. And usually old people are prone to urinary tract infections, and that really affected her a lot. So this was easy for us to get someone locally and instruct. And since then, 3 years ago, pre-COVID, my mother has not gone to a hospital for the last 3 years. That is phenomenal. This kid did not go to school beyond S4, but she has managed a person, an elder person in the village for 3 years. This is only one example of the 2 million old people we have in Uganda. Our population is now 48. It's being projected that in 20 years we shall have 75 million people, of whom 6 to 10 million people will be the kind of my mother, who are living home with chronic illnesses. Because of good governance, when the government came in, life expectancy was 47. So people were dying of diseases that are not killing people today. Wars, of course, killed people, but there are these other careless diseases. Cholera, people no longer die of HIV, AIDS, people no longer die of tuberculosis, dysentery. All those diseases have reduced. So that's why we see the population explosion in Uganda. And so at a glance, Uganda brought us the current government brought us a very good problem of the aging population that's going to be living longer and longer and longer. And I can guarantee you there's no enough hospitals in Uganda to take care of 6 million people if the symptoms of these non-communicable diseases get exacerbated, or if someone has uncontrollable symptoms of these kinds of disease. That's why Vantage Care comes in to manage these kinds of clients in the comfort of their homes. What can beat that? Managing someone in the comfort of their home, it's the greatest benefit we can give the mothers and fathers of our country. Today, they have given us education. We work away from them. Our parents are isolated, neglected, and abandoned. We have a program that instructs ordinary young Ugandans to manage these people in their homes. We instruct them to manage clients of diabetes by knowing that, a simple instruction of checking blood sugar levels, knowing that if the sugar levels are high, that calls for giving insulin. We know that if a client is confused, maybe something is going on. Usually the old get confused when they have infections, urinary tract infections. That calls for a call to the doctor. The doctor will listen to what we report to them. They will determine if they need to be visited, or if they can, say, go to a pharmacy, pick ABC antibiotic, give it to her, give it to him, and see if symptoms reduce. We can prevent a hospitalization by talking to the doctor, and they give us instructions of how to care for our loved ones in the home. We instruct our people how to maintain safety, talk about infection control, body hygiene. These people have no control of their urine and feces, and they don't know how to clean themselves better, because once they are aged, their joints are painful, they can't shower, they can't bathe by themselves, they are not safe to walk alone. We will walk with your loved ones safely. We can bring them out of bed. Some of them are bedridden, bedbound, they never come out because they can't walk. We train our home care girls, home care boys to manage these clients. We want them to feel like part of the community in their lifestyle, even when they are old. We treat them with dignity, we treat them with integrity, we treat them with empathy, we treat them with compassion, and the reviews we have had are phenomenal. No mistake, Vantage Care is bringing a positive contribution to the people that have used their services. Growing older aging is going to be the order of the day. The government is doing a very good job. They have built hospitals, we have medications, we have antibiotics, we have vaccinations. They are sensitizing the population, the whole country. People know how to eat a balanced diet. People drink clean water, boiled water. People rest. We have what we need to live longer. So that's why living longer doesn't mean you are living healthy. That's why we detect it's going to be a hand offered. Besides the government's contribution to our population, we are also coming in to complement what the good job they have done. When you use our services, it's also a research done that people who are recovering from hospitalization recover faster. When you have a home health aide in your house taking care of your loved one, they live longer. When you have a home health, when you have our services, it's much cheaper to have someone besides your parent or the sick person than staying in the hospital. People are going bankrupt because of hospital bills. So you can depend on Vantage Care, because even when someone is taking care of you decides that they have an issue to attend to, they are not available, we always have someone to substitute when they are not there. And dependability, that's what I'm talking about. One-on-one, getting what you want, when you want it, how you want it, in the comfort of your home. We do range of motion exercises that revives the body. For someone who would love a shave, we teach how to shave someone who needs a shave. I mean, from the services range from grooming, bathing, feeding, transfer, safe transfer from bed to chair, from chair to bed, from chair to toilet. All these things, we do them. We do companionship, we tell stories, we share, we read newspapers, we can listen to the music together. We do light housekeeping. Think if you hire us, we'll come, we make sure the bed is well done. I mean, who doesn't want to lie in a bed which has been well done? That's the last thing everybody wants to retire to at night. Prepare you for the night. We prepare you for the night so you can have a good night. We clean the environment where you live. The sitting room, the bedroom, the toilets, and we know safety also is important here, knowing is the food fresh? Is the refrigerator clean enough? So we avoid a lot of infections. We support these people and they love it. We hope our future can be well maintained, especially with our parents. And if we don't start now, who's going to take care of us? So I want to appreciate the community's response to our services. I want to thank Nakasero Hospital, which allows our instructed girls and boys to come and practice hands-on care before they go in the community. Kampala Hospital has also graced these services. So after we train our girls 4 weeks in class, we bring them on the floor to practice what they are going to do in the community. So there are special basic needs, humanity needs, abazungu bakitusookamu, that I'm very glad, I'm very happy to bring it to my mother country, and I'm glad that we are being received with a lot of joy. Thank you, UCTV, for giving us an opportunity to share this with you and your viewers.